We have to get these numbers down.
I am very concerned about the rise in numbers.
It's spreading right across the province, which is concerning.
Officials and political leaders clearly worried, including in Ontario, where shutdowns went into effect on October 10th. But the rate of new cases continues to rise. And in Alberta, which has held back on reimposing shutdowns and watched its average daily new cases triple over the past month. So let's get a sense of what these numbers mean to the experts. We're joined by infectious disease specialist Dr. Isaac Bogoch in Toronto and Dr. Lynora Saxinger in Edmonton. And Dr. Bogoch, let's start with you. Thanksgiving was about 2 weeks ago. Do you think that's a factor in the Ontario case numbers we're seeing now?
It certainly could be. The timing fits perfectly. And of course, the messaging around Thanksgiving was pretty clear. Don't socialize with others. Don't go into other people's homes. Keep it to the family unit. But certainly the timing does fit with the spike from possibly people getting together during Thanksgiving.
Now, on the other hand, the new restrictions were brought in around the same time. When might we see the impact of that?
Yeah, I think that's an excellent point. And certainly we know that these restrictions were imposed around 2-ish weeks ago. And there's a period of time where we would expect to see no changes, and we'd only start to see the earliest changes around now. So during this window period of when the restrictions were imposed and when we expect to see changes, it's not impossible to see growth in cases during that time. So I really think the next week and 2 weeks ahead will be very telling to see if there's any significant impact from those restrictions in alleviating the number of new cases in the community.
And Dr. Saxinger, Alberta doesn't release numbers on the weekend, but what's your analysis of what we've seen coming out of your province over the last couple of weeks?
Well, I think it's profoundly concerning, honestly. The rate of rise has been non-reassuring for a while, but the last several days have seen very high case numbers. We're starting to see more people coming into hospital, and so I suspect that this is legitimately a big concern for us.
And what are you expecting to see or looking to see in the next couple of weeks in Alberta?
Well, we did have a suggestion of voluntary restriction put forward around October 9th or 10th. If that was going to be beneficial, that should start having effect any time now, honestly. I think that there's going to be more discussion about some targeted public health interventions. I'm not sure what that discussion will look like or what shape it will take. But it's clear that we just have to get right down to the level of people not seeing as many people as closely as they clearly have been.
I want to put this question to both of you and start with you, Dr. Bogoch. When you hear the numbers, like when you woke up today and heard what the case numbers were in Ontario, what was your reaction?
I mean, it's concerning. It's certainly concerning, and it's just another sign that we need to do better on many, many fronts.
And Dr. Saxinger, I know you touched on it before. I sort of sense your tone was almost discouragement, but you tell me as you see those numbers come in.
Well, I mean, we're starting to see increasing case numbers in older people, which usually in many jurisdictions means that hospitals are next and ICUs are next. And a lot of us in healthcare look at that with, I think, really kind of grim resolve more than anything. It's not an optimistic feeling. We just would like to be able to limit the damage and continue to provide care to people who need non-COVID care. And so it's a very kind of walking the edge time, I think, right now. And we're really going to be looking for those numbers to get better.
And so speaking of hospitals, I'm not asking you, Dr. Saxinger, to give us the sort of pan-Alberta view, but what are you seeing at the hospital that you're at?
There's been a steady increasing trickle of cases coming in, many of them actually in their 50s, but some more older as well. And I think that we're already seeing a lot of healthcare workers being quarantined for symptoms, including myself, and people having to be off work for illness and COVID testing. And so the system is already showing signs of strain before the numbers go up, honestly.
And I should ask you, showing symptoms but not testing positive for COVID-19?
Right. I'm recovering from what seems to be a non-COVID cold, but it's a bad look to walk around coughing and sneezing in the hospital right now.
Yeah, and Dr. Bogoch, we have about 30 seconds, but I know I asked you this last week, but what have you been seeing the last few days at your hospital in Toronto?
Yeah, we still are seeing people admitted to hospital with COVID-19. Yeah, we've got if we were looking at our hospital, for example, in the summer, we didn't have a COVID unit. We didn't have any patients admitted for a period of time with COVID-19, and now we do, and we have a dedicated COVID unit that needed to be recreated. And certainly if we take a step back and look at Ontario, the bigger picture in Ontario, there is a real trend in a growing rate of hospitalization of patients with COVID-19. So it's real, it's happening, and we've got to get this under control quickly.
As you know, always appreciate your time, Dr. Isaac Bogoch and Dr. Lynora Saxinger. Thanks to both of you.
My pleasure.
Thank you.